Hello, my name is Dr. Tony Mason, a mental health nurse practitioner with a passion to provide emotional support and treatment options for improving mental health. Today, I will discuss anxiety. Please note this discussion is for informational purposes only and not intended to provide a clinical diagnosis. However, if you identify with some of the signs and symptoms, I encourage you to reach out to a licensed mental health provider. Anxiety is one of the most common disorders I treat. An uneasy feeling, nervousness, feeling of worry, impending doom. These are signs of anxiety. Anxiety is an umbrella term, though. It comes in many types. I'll focus on generalized anxiety, phobias, and social anxiety during this discussion. So generalized anxiety is a disorder in which a person worry and may produce physical symptoms such as increased heart rate, insomnia where they have an inability to fall asleep or stay asleep, difficulty concentrating, irritability, headache, restlessness, and everything, not just one particular situation. People with generalized anxiety disorder, you'll typically hear the term attached to them as a worrywart. This is because they worry about essentially any and everything. Now, a phobia. This is when your fears, your worries, your nervousness, it impacts your life. It can be things like you have a fear of animals. This can impact your ability to go for a stroll around your neighborhood. It will limit you from going to various places where you know animals will be. One could have a fear of driving over large bodies of water, a river, a bridge. This can limit your ability to view the world, view a road trip. Or someone can have a fear of heights. This can limit your ability to experience the world from higher views. Some signs and symptoms in someone with phobias, you may see or they may feel an increased heart rate. You may see trembling, hyperventilation, which is when they're breathing really fast. So those are some things you'll see with a phobia. Social anxiety. Social anxiety occurs when a person has fear of interacting with certain people, places, doing certain things. A couple examples. Someone with social anxiety may have a fear of public speaking. So they're afraid to stand up in front of a class, maybe, and give like an oral report. They're afraid to speak up during a meeting. They're afraid to facilitate a meeting. These are things that people with social anxiety shy away from. They may be afraid to ask help from someone in a store. So they're in a store and they're looking for something and they searched all over, but they cannot find it. But they're too afraid to just simply ask the store clerk for assistance. This fear is derived from the thought that they may be judged negatively. They may feel that they will become embarrassed. They may say something to embarrass themselves. People may look at them and judge what they're wearing, how they speak. So they're really embarrassed and have a fear of being judged. Some signs and symptoms you may see in someone with social anxiety: avoidance of activities. So avoiding doing that public speaking, avoiding speaking with someone in public. They may have increased heart rate. They may have an upset stomach, muscle tension, begin sweating. So these are signs of social anxiety. So let's talk about anxiety, where it derives from. Anxiety affects the limbic system in our brain. It's the amygdala, the hypothalamus, and the thalamus. These parts of the brain are responsible for processing our emotions. So that's the part that is heightened during anxiety and stressful situations. So people who are suffering from anxiety, I want to provide some treatment options that may be helpful. Good sleep hygiene. Incorporating good sleep practices is really helpful. Promoting good sleep allows the brain to rest and restore and rejuvenate. So some good sleep practices is trying to go to bed around the same time every night, refraining from using electronics in bed, refraining from watching television in bed, decreasing your caffeine intake during the day, eating a healthy, balanced meal, exercise and yoga. Again, I spoke about this in my other podcast. Exercise and yoga are really, really effective as they promote blood flow to the brain, and it increases healthy endorphins, the feel-good endorphins. If you're a smoker, try to stop smoking nicotine products. Nicotine constricts the blood vessels, which can raise your heart rate, raise your blood pressure, increase your anxiety. Avoid recreational drugs like stimulants, cocaine, methamphetamines. These type of recreational drugs constricts the blood vessel as well, has a terrible impact on the heart, and can certainly increase anxiety. Deep breathing, again, it will help with improving your oxygen consumption. It will help with decreasing blood pressure. It can help with decreasing your heart rate. Massage therapy, finding a good masseuse and getting a weekly, monthly, bi-monthly massage. Those are really helpful for releasing the muscle and the tension, which can help with managing anxiety. Engaging in daily self-care. I promote all of my clients to engage in at least 30 minutes of daily self-care. Some type of activity where you're focusing on yourself, whether it's improving your physical, mental, spiritual, financial, emotional health. Focusing on an activity where you're pouring back into yourself. That will help with decreasing your anxiety as well. Making a daily to-do list and marking off items as you complete them. That's one way of managing anxiety. Take care of the things that you have within your control first. And as you take care of them, mark them off the list. And the things that are more challenging for you, solicit help or watch videos to learn how to do that particular skill, but doing things to help complete tasks. Getting connected with a psychologist or a therapist or a counselor. They can provide evidence-based therapies. Two really good therapies are behavioral modification and cognitive behavioral therapy. These are very useful for managing anxiety. If none of these options are managing your anxiety to the level where it's not impacting your life, pharmacological therapy, which is medication, is an option to assist you with physical symptoms such as increased heart rate, trouble sleeping, hyperventilation, which is breathing really fast, sweating, headaches. There are effective and safe medications to assist with managing these symptoms. So if you or someone you know may be experiencing some of the signs and symptoms surrounding anxiety that I've discussed, I encourage you to get connected with a licensed mental health provider and undergo a full assessment, and which at that time an assessment can be completed. Treatment plan can be developed to help you manage these symptoms and live an optimal, healthy life. So if you like this podcast, this discussion, I would encourage you to like and subscribe to my channel for future discussions. Thank you and have a great day.